So the major risk for lung cancer development is smoking and using tobacco products. I think a lot of patients have the misconception that vaping is a safe alternative to smoking and a way to intake nicotine without incurring the risk of lung cancer, but that's actually absolutely not true. There are studies that show that patients that vape and smoke are 4 times more likely to develop cancer than if you just smoked by itself. So while there's further studies needed to link vaping and development of lung cancer, most likely they are related. Even if you're vaping non-tobacco products, like for example THC, there are chemicals within the cassettes, the cartridges, that are harmful to the lungs, and there is definitely a link between chronic inflammation and inhaling toxic products with damage to the lungs, not only lung cancer, but other types of chronic lung diseases that can affect your breathing. I think participating in a smoking cessation program is probably the best way to try to quit smoking, because you have a structured program with support that can aid in that process. So the rate of return to smoking in patients that are trying to quit is very high. That's very common, nothing to be embarrassed about or ashamed of, but I think being part of a program would decrease that likelihood. Here at RWJBarnabas Health, we have several smoking cessation programs that are available to the public. Many of them include dedicated smoking cessation counselors that can help patients through the process. They're able to prescribe smoking cessation medications as well as nicotine replacement.